Hi guys, Shweta is welcoming you at the Pharmacy Crash Course Division in the Knowledge Club online. I came today with the topic heart sound. What sound you heard from your heart? Lub-dub, right? Or another. In previous 2 episodes, we learned about cardiac cycle and ECG. Heart sound, one of the simplest yet effective diagnostic techniques applied to assess the state of a patient's heart, is auscultation using a stethoscope. How it works? No more. So let's start. In a normal, healthy heart, there are only 2 audible heart sounds. That are S1 and S2. S1 is the sound created by the closing of the atrioventricular valves during ventricular contraction and is normally described as a lub or first heart sound. The second heart sound, S2, is the sound of the closing of the semilunar valves during ventricular diastole and is described as a dub. In both cases, as the valves close, the openings within the atrioventricular septum guarded by the valves will become reduced and blood flow through the opening will become more turbulent until the valves are fully closed. There is a third heart sound, S3, but it is rarely heard in healthy individuals. It may be the sound of blood flowing into the atria and blood sloshing back and forth in the ventricle, or even tensing of the chordae tendineae. S3 may be heard in youth, some athletes and pregnant women. If the sound is heard later in life, it may indicate congestive heart failure, warranting further tests. Some cardiologists refer to the collective S1, S2 and S3 sounds as the Kentucky gallop because they mimic those produced by a galloping horse. The fourth heart sound, S4, results from the contraction of the atria pushing blood into a stiff or hypertrophic ventricle, indicating failure of the left ventricle. S4 occurs prior to S1 and the collective sounds S4, S1 and S2 are referred to by some cardiologists as the tennis gallop because of their similarity to the sound produced by a galloping horse with a different gait. A few individuals may have both S3 and S4, and this combined sound is referred to as S7. The term murmur is used to describe an unusual sound coming from the heart that is caused by the turbulent flow of blood. Murmurs are graded on a scale of 1 to 6, with 1 being the most common, the most difficult sound to detect, and the least serious. The most severe is a 6. Phonocardiograms or auscultograms can be used to record both normal and abnormal sounds using specialized electronic stethoscope. Doctor tells us to breathe loudly with stethos, right? Why? During auscultation, it is common practice for the clinician to ask the patient to breathe deeply. This process not only allows for listening to airflow, but it may also amplify heart murmurs. Inhalation increases blood flow into the right side of the heart and may increase the amplitude of right-sided heart murmurs. Expiration partially restricts blood flow into the left side of the heart and may amplify left-sided heart murmurs. So, we learned about heart sound today. I think it's now very easy to understand right now. Revise all episodes on heart thoroughly. I made it step by step accordingly. Here all previous episodes list on heart anatomy and physiology. You will get all links at description part of this video, or you can visit our channel. Next episode we will complete the physiology part of the heart with the topic autonomic input or influence on heart. After that we will move towards pharmacological part. Before ending today's episode, if you like this video, then like, share and comments freely, and don't forget to subscribe our channel. After subscribing the channel, please click on the bell button to get our updates regularly. I am coming with the next video on very shortly. Till then, goodbye.